with the intention of creating like safe spaces that support transformation to occur, then it's called outdoor therapy, and they create a very contrasting environment in a way to what you're usually experiencing, and it allows for people to experience themselves in new ways.
Tanya Ginwala is a mental health practitioner, experiential facilitator, and outdoor therapist based in Dharamshala, India. With prior professional experience ranging from rehabilitation for substance abuse to inclusive adventure programming, she has amassed experience working with a multicultural, diverse audience across geography, age, and socio-economic backgrounds. She is passionate about the intersectionality between adventure, nature, disability, and mental health, a grossly underexplored terrain in the Indian context. Let's understand more about Tanya, her journey, and her initiative, Qualia Outdoor Therapy. Welcome, Tanya, to Only Green.
Thank you so much, Abby. It's a pleasure to be here with you.
Okay. Tanya, you did your master's in clinical psychology and have come a long way now. Can we get to know more about your journey and how you finally reached this specific program of outdoor therapy?
Right. So while I was doing my master's in clinical psychology, I sort of always knew that, I wanted to do counseling and work with human beings. I knew that. But while I was doing my master's in clinical psychology, I was also started learning about something called experiential education. And as I was learning, and that's more about like facilitation, creating a safe space for people in groups and individually. And I started seeing a lot of like overlaps and interesting connections in what I was learning in my experiential education course. And I realized that the application of a lot of what we were learning while we were doing the diploma in experiential ed was actually called outdoor therapy in an international context. So when you bring like mental health and nature and adventure together with the intention of creating like safe spaces that support transformation to occur, then it's called outdoor therapy, and there is such a thing. So a lot of people, when I say outdoor therapy, they think I'm making it up, right? They think like, oh, there's nothing like this, and but there really is. There's a beautiful community of people around the world who are doing this work. And so I went for an international adventure therapy conference back in 2015 in Colorado in the US. And just at that time was just curious, just seeing like, is this something that I see myself doing? And I could think of nothing more powerful than collaborating with the natural world for healing and transformation, right? Because then it was just like, how can we not do this outdoors? Like, it doesn't make sense to sit indoors in a room anymore and be doing talk therapy. And then I've gone on to certify in a lot of outdoor courses, so hiking courses and just risk and safety management related courses, and also in wilderness medicine, and then sort of trained in both these fields to bring that together. So it's been quite a journey so far. Yeah.
During that intro part of it, you mentioned about wilderness medicine. Can you elaborate more on that particular term? I didn't understand that.
Yeah. So I'm also a wilderness first responder, which is basically the wilderness medicine course is about when you are working in remote regions with people, right? Like we take people on hikes and we're very far away from hospitals and any kind of medical facility. Then how do we, as facilitators, as group leaders, at least we're able to provide so it's a very intensive first aid course, right? It's a 10-day first aid course. So it teaches us basically when do we need to evacuate people and how fast, and how can we offer that first responder care before we're able to get them to a hospital or a medical facility. So of course, that because both physical and emotional safety are a big part of our work. And this comes under that whole physical safety realm, right? Because we want to make sure that the people that we are working with are safe when we're outdoors with them.
Okay. You might also mentioned in your website that you work with people with physical disabilities
Right.
and that too taking them outdoors. Can you give us a brief on this? I mean, how is this being planned and how do you handle it and what are the benefits of that? How do they benefit from it?
Right. Yeah. I used to work with a not-for-profit where we promoted social inclusion for people with physical disabilities by getting them to participate in adventure sports with non-disabled people like you and me. So the main challenge with folks with physical disabilities is that we don't interact with them and we don't see them around and as much because they're often not in our schools or in our offices or even in restaurants and public spaces, right? And that's due to a lack of infrastructure in our country. And that's also due to stereotypes and just ignorance, And so it's kind of like a loop, this problem, right? So somewhere we wanted to sort of intercept and say, okay, one way that we can get these two communities to interact and just play together and get to know each other, to dispel all of those stereotypes and ideas, is to get them to participate in adventures together. So we would take them hiking. They would, say, like a blind and a sighted runner would pair up during a marathon and run together. We did scuba diving and paragliding for people who are in wheelchairs and have spinal cord injury. So we worked across disability. And we also worked across these different adventure sport activities, right? So that I think was extremely powerful. One, because so many people with disabilities are just told that that they don't belong outdoors, right? Like the first question I would get is like, that even my blind friends get is like, what are you doing here? And often they don't realize like my blind friend is the one who's taken me up the mountain, really, and it was their plan, and it's not like we are the ones wanting to do that. They also, I think, as people with disabilities want to have fun, they want to engage with their bodies, they want to connect with nature, and that's just a basic human need that all of us have, right? So first of all, they're denied the right to that, which is not okay, because ableism doesn't allow for them to experience these little joys, and the freedom to access nature and healing for themselves too. So I think how I've seen it benefit both people with disabilities and able-bodied folks is, firstly, when you have a group that's mixed like this, right? Like you have some blind participants, you have some amputee participants. It also kind of, what we noticed is it made room for maybe even like older able-bodied folks to participate in some of these activities, because they would think, oh, let me try and see if I can also do it. And because it would be facilitated in a way that's also emotionally safe for everyone, which means there's no pushing or forcing, or there's just a gentle, encouraging environment in which you can try something new. So that it allowed for, like, we had a lot of, on our cycling expeditions, for example, we had a lot of senior citizens who would also participate, and we've done like Manali to Khardungla, which is like 550 kilometers, and pretty challenging expeditions as well. And I think it just makes for a more inclusive environment for people, to safely explore themselves.
So when you take these disabled people for an outdoor therapy, you mean to say it's a group where the entire, I mean, it is not completely disabled people. You have
Yes,
people with disabilities.
mixed.
Okay.
Yeah, and that's the whole point, because we kind of want to look at social inclusion and not segregation, which is how a lot of this is happening, right? Like we ask a lot of people, did you have any children with disabilities in your class when you were growing up? And most people say no, because the schools there are special schools for people with disabilities. And that's where the problem starts, right? Because now there's all this awkwardness. And also we would work with companies that wanted to hire folks with disabilities, because if we don't, so we would take them on treks, get them to interact, because if they don't interact and just have fun and get to know each other, then it's hard for a manager to say, give give feedback or work with someone who's a disabled employee, because there's all this awkwardness around it, and that's essentially what we would begin by dissolving that, and so that then there is like true social inclusion.
Now, you've been talking about outdoor therapy. Can you, for a layman, I mean, when you say outdoor therapy, we've heard of a lot of terms like nature walk, a lot of things like that. But then what exactly is outdoor therapy?
So outdoor therapy is like an umbrella term for many different therapies that are collaborating with the natural world for supporting healing. So under outdoor therapy, there is also like equine assisted therapy. So there's like working with horses. There's other kinds of animal assisted therapy. There's forest bathing, which you already know a little bit about. They could be programs that involve like hiking and other different adventure activities like mountain biking or surfing, or so it's basically an umbrella term for all of these different activities. And again, the main thing is that it's a very intentional use of adventure and nature for that. It's not just the same as just doing this, say taking a conversation outdoors. That's one aspect of it. That's just the first layer. There is a lot more. We also design activities based on what the client needs at that moment. What are they looking for, and what activity will sort of facilitate that. So it's the word intention is really important, and that the fact that it's done by a trained professional is really important.
Right. See, now, I mean, you've been telling me that you take people in groups. And your website again says individual and collective well-being, and interlinking that with a strong connect to the nature around us. What exactly is this? I mean, is it team building, or do you do it as a corporate exercise?
Right.
How do you handle this?
So different ways, right? And I'm still exploring new ways also. So it's not, I think I'm still in that space of reaching out to different populations and working one-on-one, yes, but also in groups. So when we do outdoor therapy in groups, then the group size is limited to just 8 people at the moment, because that's again very important, right? Because it's a therapeutic space. It's not just any trek where you can take like 30 people and just go. So there are different ways in which we do that. I also work one-on-one quite intensively with people. Often I've had clients visit me here in Dharamshala, and then over 3 or 4 days, we would plan out a few activities. We would figure out what our goals are, what kind of outcomes are we looking for, or what are the areas we want to explore. And then accordingly, we would design a 3 or 4 day intervention with the client. And again, so it can be in individually done and in groups. But I think this sentence that you picked out right from the website, I think what's also important is that I think the current mental health model that even in India is largely influenced by the West and the individualistic cultures that are informing the way that we look at mental health, right? Like even if I look at my master's program, it's a very Western approach to mental health. It's really looking at this very one-on-one. I mean, yeah, they talk about group therapy, sure, but if you look at our roots, we're more collectivistic in a lot of parts of our country, and we still are till today. But because of colonization and capitalism and just white supremacy as well informing our practices, we've lost touch also with our own unique and old wise ways of responding to mental health challenges, right? So this whole one-on-one thing is quite new. It's quite recent if you look at our history. So I've also then tried to, study Buddhist psychology and look at, okay, how do we look at also wisdom from Eastern traditions and bring it together? It's not to say one is better than the other. It's to bring it together in a way that's relevant for our current climate and the very complex challenges that we are facing. Because I understand that even our culture is not now, it's neither individualistic nor collectivistic. It's like this big meeting of both these, in today's day and age, right? So how do we, it's also about connecting back to old wise ways of healing and moving through the world, and making and kind of bringing together this individualistic perspective and the advantages also that are there, and kind of finding a balance between these approaches, so adapting that.
So you do corporate packages also for team building exercises like team
Yes,
building?
yes, we do that as well.
There also you limit your group size to 8, or it can go beyond that?
So it depends on the program and the objective, because each program is really designed and tailor-made to the objectives and the client who's coming in. So it really depends what they're looking at and what their preferred outcomes are. Like with senior leadership, it's possible to do smaller groups and actually have more focused conversations and support them to be a part of more therapeutic journey. If you're looking more at like team buildings, and that's not so much therapy, but there is space to take more people in a group. So it depends.
Which are the locations that you take these people to?
So as of now, it's been a lot around Himachal and mostly around Dharamshala, because it's very accessible also for people to come here. In the past, there's a lot of my work has been in the Sahyadris, so around Pune, Mumbai. So yeah.
Now, I mean,
I'm also keen to explore other parts of the country as well, and team up with people to work in different parts. Yeah.
Okay. You have also started your own initiative, the Qualia Outdoor Therapy. Why should somebody come to you for outdoor therapy, and how can they approach you? What is the process?
Yeah. So I think I'm just going to think back to why also some of the people who have been part of the program, what they've been looking for and why they've come, right? And I think one thing is that when we change the environment also within which we are healing, and we kind of go to this we create, actually at an outdoor therapy program, we create a very contrasting environment in a way to what you're usually experiencing, and it allows for people to experience themselves in new ways, to gather new perspectives, to feel connected with their bodies, because a lot of us are walking, through our lives feeling quite disconnected. And that's also what trauma does. It disconnects us from our bodies and from ourselves and from each other and community. And so what we're doing essentially is creating a relatively safe environment within which you can sit with these questions, where you can explore, you can learn from other people what their experiences have been. And actually, a lot of our groups, for example, have been quite heterogeneous, which means that there is different age groups. There is something to be learned from someone who's, say, maybe in their early 60s, learning from someone who's in their early 20s, and vice versa. And that has worked out really well. A lot of programs abroad do these very homogeneous approaches, and that also helps for different situations. But we're really enjoying also this sort of mix of bringing people together who are coming with the same intention, which is to one, we help them to connect to an intention of why are they coming here, what are they hoping for. So, for example, we work online before and after the program. Then there is right now it's like an 8-day program format that we're working with. And so there is that support before and after to facilitate and do a bit of hand holding as well. And I think who comes to the program, I think it's mostly people, one, as I said, who a lot of them already feel connected to nature a little bit. They know that it's the place and the space that really makes them feel more whole and connect and nourished. So they have that sense that, okay, I just feel my best when I'm outside. So a lot of the people we worked with so far come with that little bit of just that sense And then we deepen into that and what that could mean, and then see how that could translate into what they could take back from that back home, you know. So there's often, people who have struggled with different mental health conditions. So it could be that there's someone who has like a chronic back pain that wants to slowly be able to venture outdoors and enjoy being outdoors, but they're really scared because they don't know if the environment will be suitable for them. So because I've worked with disability, it's actually very easy for me to work with people of different physical abilities. And it's not like, the question is more like, okay, how do we make it possible for you to be here, rather than, oh, will you be able to do it or not? It's more like, okay, what do you need so that you can participate in this? And so we work with that approach. And yeah, I just want to add that there are also a lot of people who, I guess, who come in, I think they come in with working on specific trauma that they may have had. They want to learn to connect with community, but then the group becomes a safe way to do that. After they're healing from something, it's maybe a lot of times it's the first time that they're sharing their story. They've been dealing with something all alone, and it's the first time that they open up and share their story, and that leads to being able to do that outside of the space also. And it's been extremely powerful. I think that's been really, really powerful to create a safe container for that self-exploration to happen.
Okay.
Yeah.
There's a music in the way you talk about
Around decolonizing the field, around diversity and inclusion in this space. Because so there has been a stance that we've taken as an international community to say we are not okay with programs that are not that don't have choice.